Hi, this is Dr. Darwin, a new dentist coach with another edition of As Dr. Darwin on the New Dentist Podcast Show. Where you ask questions, you can send those questions right here, newdentistcoach@gmail.com. You send those questions and we get those answers for you. Whether you're a pre-dental student, current dental student, resident, or even an international or foreign trained dental student or foreign trained dentist, who's even looking to come to the U.S. to be licensed in practice. I've been getting a lot of inquiries over the last several months about how to come over and practice dentistry in the U.S. So those questions and a lot more you can ask on this platform. Today we're going to be talking to Dr. Paula Coates, and she's going to be sharing with us on how to become a pediatric dentist, a pediatric dentist. PEDO is one of the probably most popular specialty programs, and it's probably got to be in the top 2 or 3 right now as far as difficulty in getting into. So she's going to share a little bit maybe about her experience, but also talk a little bit more about the profession. So Dr. Paula, welcome.
Hi. Hello.
How you doing?
Fine. How are you?
Good, good. Happy belated birthday.
Thank you. The other day.
You doing okay after the birthday celebration?
I am. I had
That's
a great
good.
day.
That's good. Well, thanks so much for joining us, and we want to hear a little bit about this specialty of pediatric dentistry that you have made the jump into some years ago. So first of all, tell us a little bit about yourself.
Okay. Again, good evening to everyone. My name is Dr. Paula Coates. I am a pediatric dentist, and I started my quest for dentistry back in 1996, where I attended Meharry Medical College School of Dentistry in Nashville, Tennessee, Meharry. Right. And then I decided that I wanted to be a pediatric dentist my 3rd year of school, and I applied, and I got accepted into the University of Illinois, Chicago, and I finished that program in 2002. And I decided to hang around an extra year, finish up my master's, teach in the pre-doctoral clinic, and work. And then I decided to move to Atlanta, where I began working as an associate, and I worked at several offices. And then decided to try academia. Did that a couple of years, went back to Meharry and helped out a bunch of students that were interested in being a dentist. Then I decided it was time to come back to the DC area to take care of to help my parents out. And so I'm back here, and I'm working in a private office. And pretty much outside of the few years I did academia, I've been in private practice as an associate. So that's why.
Gotcha. So, so what is it like being a pediatric dentist? What's your typical day like as a pediatric dentist?
Okay, well, it's very unpredictable. Usually, depending, like if you are working in private practice, you're gonna have typical hours. Some are like 7:30 to 4, some are 8 to 4, some are 8 to 5, or some might have half days. But pretty much, you're gonna come in, and depending on how the office environment is, you're gonna start with huddle and go over what's to be done that day, and you're usually gonna have lots of assistants because you need lots of assistants to work with children. This isn't like general dentistry where you can leave a patient sitting by themselves and they can read a book or watch TV for like an hour at a time. You're gonna have tons of assistants, probably tons of hygienists if this is a huge practice, or even if it's a small practice, you might have one hygienist and several assistants based on your room. And you're literally jumping from patient to patient. Pediatric dentistry is about volume. So a lot of patients are being seen simultaneously. If you have hygienists going, they're doing the cleaning, and you could be doing treatment. So you're usually, how I've been, working, I usually jump from chair to chair. I do checks, go back and do restorative, get up, go do checks. That's pretty much how it is. I haven't done OR in a while, but there are people that do take days where they take cases to the hospital and they do all the treatment under general anesthesia, or they have a dental anesthesiologist come into their office and do the treatment there. I used to do oral sedations, and that would be probably like in the morning time, and then see regular patients in the afternoon, because you have to keep the kids on an empty stomach, and you don't want to do that. Have them hungry all day. But it's fun. I mean, it's never a dull moment, because kids are not predictable. Neither are their parents associated. And I always say, like, you're literally on your performance mode. I mean, you literally, as soon as you hit the ground running, you're performing in order to get a child in the chair, or get them to open their mouth, or try to distract them from getting an injection. You're constantly performing, and you usually leave home a little wiped out, but you get up and do it the next day. So I mean, but it's lots of fun. So again, never a dull moment.
So with it not being a dull moment, what are some of the procedures? I know you mentioned restorative. There's also some checkups that you do, but more specifically, as far as actual dental procedures, what kind of restorative procedures would someone typically do or expect as a pediatric dentist?
Okay, well, with us, there's not that many procedures that we're going to do. We're going to do your basic preventive. That's your prophy, your fluoride, scaling if you have to. Believe it or not, there are kids that walk up in there with calculus or tartar on their teeth, so you do have to pull out the scalers, or even sometimes a cavitron. As far as restorative, basic restorations, fillings, depending on the practice where you work, or if you choose to have your own. Some people do not use amalgam restorations anymore. They're strictly white color fillings or composites. We do a lot of stainless steel crowns or full coverage restorations. There are even more aesthetic crowns out there, and that's when the teeth are really bombed out, but we're trying to save them. We do extractions, simple extractions of baby teeth, and sometimes we might even have to do permanent teeth, for orthodontic request, or based on your comfort level. Sometimes the children, they will have bombed out first adult molars. You have to remove them, but it's based on your comfort level. We do space maintenance, where we're placing space maintainers to hold the space for the back teeth. We might have to do habit appliance cessation, placing appliances to stop the thumb or finger habits. Sometimes, based on training, some pediatric dentists are comfortable with doing like some early interceptive orthodontics, but that's all based on training. Also, based on training, a lot of pediatric dentists are getting into more lasers, where they're doing frenectomies for babies and infants when it comes to like feeding and being able to latch on for nursing. They're doing like maxillary frenectomies or lingual frenectomies. But pretty much that's it as far as restorative. Lots of pulpotomies and crowns. That's a lot. But for us in pediatric dentistry, that's all basic. We can do that with our eyes closed. Our niche is the behavior guidance and the behavior management. That's where we sort of stand apart from our colleagues, because a general dentist can do a lot of that. But oftentimes a general dentist doesn't have all the training that we do, or the comfort level in managing those behaviors, or having to put them in the papoose blanket if we need to, or sedating them. So that's where we stand apart. And we also are trained to work with individuals with special healthcare needs. So oftentimes, we see patients that are severely autistic. They cannot speak. Just getting them into the chair may take an hour. I mean, and you have to be prepared for that. We may just be able to brush one tooth, or with the toothbrush, and bring them back, and then introduce them to something else. I mean, some kids we've had to like try to introduce them to the nitrous nose, have them take it home, and the parents practice with them. These are all the things that we have to do from time to time. But again, you never know. I've had some kids that are, were like climbing the walls one visit, and the next visit they come and sit in the chair. So that's pretty much what we do.
Wow. Okay. Sounds pretty Pretty basic. What about the work hours? What are some of the typical work hours as a pediatric dentist?
Okay. Well, most places are open like 8 to 5 or 8 to 4, and usually have like an hour lunch. Some places I've worked have had half an hour lunches. Some practices have Saturday hours, and that depends a lot of regionally where you are. You're gonna find some places I found here in the DMV, they're huge on Saturday appointments. Whereas when I was in the Atlanta area, it wasn't that much, there weren't a lot of offices that did Saturday hours. But here it's almost a demand. Some places, they want to have later hours, but the thing about that, you have to be very careful because children, based on their age, really don't do well at certain times of the day. So, if you have a late office hours, that should be set aside for your older kids, your teenagers, your older kids in school, because a lot of parents don't want to miss school. But having a 3-year-old come in at 6 o'clock, I've seen it done, but it's kind of hard on the kid because they're tired.
Yeah.
So it depends on what the office has in place, or if you had your own office, what you'd like for your preference.
Gotcha. Okay. So typical salary. What's the typical salary range that one can expect for becoming a pediatric dentist? And I know it's going to vary if you have your own practice or if you're in academia, whether you be at a school or a residency program versus maybe being a private contractor. So Can you kind of give us maybe some typical ranges for those scenarios?
Okay. Well, as a independent contractor or an associate, depending on where you live, on average, you're probably going to get a range between, I would say, 170 to high 200s, depending on where you are. There's some places that I've seen advertised that will get 300,000 coming out. It depends on the need that they have. So if you're in a place where there's a high demand for pediatric dentistry and they need one badly, these residents coming out of school, they can make almost 400,000.
Right.
Whereas I have seen places where it's been like 150. As far as hourly, I've seen ranges from 800 to 1,500 an hour.
Wow.
Again, depending on the area. I have been both an independent contractor and I've been an employee. An independent contractor, you're going to have to set up, an S corporation or LLC or, one of those things. I have an S corp, which you have to have, and that's something that you just go in and you give your W-9 and then you get your 1099, and that's a good way because you're able to write off a lot. But you have to be very good about, setting aside money for your quarterly taxes. Don't get caught up. Set it aside. Get your accountant to make sure you know what you need to set aside. Or, like I said, be a regular employee and you have, you get your W-2 at the end of the year. Some stats that I looked up with AAPD's Pediatric Oral Health Research and Policy Center, the last year that they have reported in 2015, the average inflation adjusted net income was $284,670. That was for
283, 86, 284. Wow. Okay.
Now, if you had your own office, I'm assuming, because I've never had one, that if things go well, you can make more. So, but there's always overhead and all those other things that people don't take into consideration that an owner has to go through in order to, they may gross $1 million, but your overhead is a certain amount and you have to pay, pay your staff and all that. So, but it is a very lucrative specialty. I think that's one of the reasons why it has become so popular, because the salaries are high and you don't have to do as much like a general dentist is doing implant restorations, root canals, all this stuff. We're doing a specific amount of procedures, and it's volume based, and the children are usually covered by insurance. So a lot of people are saying, hey, PEDO's where it's at. And
Yeah.
that's great, but most importantly, we hope that people want to go into pediatric dentistry because of their love for children.
Yes. And you have to have a love for children if you're going to be in PEDO.
And unfortunately, there's some people that I'm like, come again, and you can tell that they shouldn't have been a pediatric. But for the most part, everybody who applies, they pretty much love kids.
Yeah. I would think that would be the main obstacle for a lot of people who don't go into peds.
Exactly. But like I said, and some of the places where you work, they might have it like production based or salary. So if you're on production of collections, a percentage production of percentage production or percentage collections depends on how well you would do. If you're gonna be a gunner and kill it, yeah, you're gonna take home a nice amount. But if you're sort of like status quo, like I'm fine here, it depends.
Right.
The salary. So.
That makes sense. That makes sense. So here's a big question. Here's a good question for you. Knowing what you know now, being that you've been in the profession and in the specialty for several years, knowing what you know now, what would you do differently?
Okay. Well, knowing what I know now, okay, I think a couple things. If I had a way to learn more endo.
Ah.
And the reason why I say that is because we have a lot of patients that are older, special needs, that have accidents or whatever the case is, and these are patients that we cannot do in the office, that we might have to take to the hospital. Mm-hmm. Well, if I'm not that comfortable with endo on permanent teeth, so guess what? I'm not going to be able to do that in the OR. So I know that that's an area, if I had to go back, I would have either said, hey, I might even consider doing a general practice residency, or I would have gone straight to my department, the director, and said, hey, is there a way that I could possibly do some collaboration with the endo department so I can do more cases? Looking back, because that's one of the areas that I wish I had more experience in, is endo, because a lot of kids need their immature permanent teeth need treatment.
Right. Are you finding that to be the case more as of recently? Is there a trend that you've been seeing that's been developing, or has that always been the case? Do you think?
I think it's kind of always been the case, depending on the area, like the demographics. A lot of people don't realize that those big teeth in the back are adult teeth. They think that they're baby teeth, and they don't do anything. They don't take care of them, so they end up losing those 6-year molars, which could be saved endodontically. Lots of trauma. I do think we're seeing more trauma now because of like all the activities that these kids are in. They're not wearing mouth guards like they should. But that's that. Let's see, what else, knowing what I know now. I guess there's some days when I wake up and I'm like, shucks, I should have started practice years ago. And I'm not saying that's out of the question, but heck, I should have done it. I guess I was too fearful, and I didn't think that I could do it. But after working all these years, I was like, man, I could have done this. I really could have done that. So that's one thing.
What were you fearful of? Just not having enough support, not having enough money.
That failure too.
Yeah.
Yeah, I just think that. Knowing what I also know now, I would also consider possibly doing the National Health Service scholarship to help pay off some loans, or even go into the military as a specialist to get those loans paid off. For most specialties, especially pediatric dentists, the military is going to send you away.
Yeah.
Because of, the families being overseas to see the children. So it wouldn't have been that many years that I would have had to give them.
No.
And I
No.
would be able to, retire early or, go into private practice when I retired or go teach. So
Yep.
knowing what I know now, military is not bad. Great option.
Yeah.
Scholarship, great option.
Yep.
Pay off those loans. Do it.
That's one of the best options.
Exactly.
Especially now. And you'd be surprised, a lot of the branches, Navy, Air Force, and the Army, they are just lacing new dentists, whether you're a GP or a pediatric dentist, they are lacing them up with these astronomical bonuses. I mean, I talked to someone recently, there's an Air Force recruiter, and she's talking about like $100,000 bonus,
right.
which is 5 times as much as I remember getting, or at least 3 times as much as what I remember getting just for signing on to do an additional year for doing from 3 years to 4 years. So
Yep.
Very good point. I'm glad you shared that with. That is an option for a lot of those people that are thinking about pediatric dentistry, but also thinking about how they're going to help manage some of their loans, because that's a big issue for a lot of new dentists right now, with an average of about $287,000 is the average amount that a lot of people are coming out of school with the loans. We got some people here on Facebook Live that are agreeing, like, yep.
And some programs do, pay salary, but there are some pediatric residency programs that you have to pay.
Right.
Tuition. And sometimes it might, if you're gung-ho about being a pediatric dentist and that's the program that you get into, you're going to take it, but you're adding on additional money. So
that's right. I got Dr. Hayes, my cousin here, Dr. Christopher Hayes, said $150,000 sign-on bonus for the Navy the last time he checked.
Wow. Exactly. Unreal. Yes. If I can go back in time.
Well, you can. Hey, they still looking for people right now. They can go to the Navy. Look, as long as you can swim.
As long as you can swim, do the physical.
That's right. Okay. Oh my God.
Another conversation.
All right. But that's some good stuff. That would be some good things to to kind of reflect on as you kind of made your assessment. What advice would you give those pre-dental students or current dental students, or even those that are on the fence, that are doing a residency right now, that are on the fence about, is it PEDO and ortho? I know usually that's one of the ones I get a lot, is they're stuck between PEDO and ortho. I even know some people that are orthodontists that want to do PEDO, and I know some pedodontists that are now going into ortho. So what advice, what's some advice that you would give some people that are out there that are considering this specialty?
Well, I would definitely say if these, especially the pre-doctoral students, that you need to first, make yourself known to your faculty at school that are within the department, and sit down and talk with them about your interests, and hopefully they will be supportive of you and give you some advice, maybe even start shadowing some offices. So most of us, I know I was very fortunate to have an awesome pediatric dentist here, so I was able to come home and shadow him when I was home. There probably are some offices locally close to the school where you can possibly go volunteer and shadow and see how you like it. If you're fortunate to get a little part-time job, that's great. I was able to do that. The late June Owens was my mentor. She was one of my professors at Meharry, and she used to have students work with her on Saturdays. And that's when my first day, my third year, I was like, this is it. This is what I'm going to do. The kid was sitting in the x-ray room, and he cracked me up, and we were just having a little conversation. He probably was like 8 years old. So those are things that I would recommend. And then if you're interested, I would consider joining as a pre-doctoral student, the AAPD. And also, if you don't have a chapter established at your school, the pre-doctoral chapter of the AAPD, look into starting one, or if there is one, get involved there. There's a lot of things that you need to consider, because it is very competitive, as you stated early in the intro. And I think now, like, oh my gosh, if I had to apply now, whoo, it's just it's madness.
Yeah.
These applicants are awesome, and
Yeah.
you have to just if you know you have an idea, you have to be strategic about things. You have to make sure your grades are good. You have to make sure that you have made some good relationships with professors and individuals that are going to write you great recommendations. And I know these are things that you've already talked about. For pediatrics, I would definitely make it your business in going to visit these programs that you're interested in applying to.
There you go, folks. Visit the program.
Because a lot of times, I'm going to be honest, I don't think it's written law, but I have heard through the grapevine that some of these places, they don't even offer interviews for people unless they've done an externship. So
an externship. Now,
meaning you have visited them and you have gone through their little, whether it's a day or two. Some people aren't even, offering interviews unless they quote know you or have seen you. So that's very important.
Oh, so that's good to know.
Yeah, these are things that you have to budget for. Budget, to be able to travel for interviews. Let's see, pediatrics. What else? Just doing things to make yourself stand out.
Like what? I mean, besides visiting the program, that's definitely gonna make you stand out. What else?
Just like your community involvement, your leadership. If you're able to do any type of research, publications, being involved, like in your church. I mean, anything. And it doesn't always have to be kids. Of course, kids should be a focus, but you need to have a really strong resume, CV. Again, because you have all these people applying. And then when you go for the interview, if you're fortunate to go for the interview, understand that the residents do have a say so. So when you go to the little sessions, the happy hours and things like that, be mindful of your surroundings because they're watching you. Be careful about your social media presence. Probably talk about that too, because they're starting to look at things. And also there are some programs now, not all, but that are requiring that new test that they have out, the ADAT, the Advanced Dental.
Yes.
So, you might have to consider taking that because now, when they turned the boards into pass-fail, they don't have a way to weed out people. So they're trying to find ways to weed out people because back in the day, we got numbers on our board scores.
Yeah.
So if you didn't get a certain score, you
were done.
Right. So if you can pass with a 70 something and you can pass with a 90 something, so they don't know that. So they're going to find ways to try to weed you out. Get your applications in early. As soon as they open, because I have literally seen it where they don't look at applications after a certain date, even though the
deadline hasn't been met.
Like October,
right?
They've gotten all the people that they want, so you need to get it in early, and just go with an open mind and be on your best behavior, but be yourself too at the same time. But if you're animated, if you like kids, if you like to teach, because pediatric dentistry is one of those specialties that there's a huge teaching component underwritten because you're trying to teach children proper behaviors, oral health care. You're trying to teach them not to be afraid, and you're teaching the parents too. And that's another thing they don't really talk about. These kids don't walk in off the street by themselves. They come with their parents, their guardians. So that's another element that you're going to have to learn how to deal with as well.
Yeah, I think that's a good point about the teaching aspect, because you are teaching the children and you're teaching the parents. And lots of times the parents can be very reluctant and say, oh, no, I tell them that and they don't listen to me and all that, so, but you still have to teach them, the parents, what that means when they don't pay attention and what the consequences could be for the kids too as well.
Absolutely.
So that was some good advice. I took some notes here and we'll post that up here. But even I think it'd be even better if people were able to contact you, if they had further questions about your journey and other pieces of advice. So what's the best way for people to get in contact with you?
Sure. They could find me on Instagram. That's Paul Coates, Coates DDS MS. I also will answer my email, and I'm old school. Yes, I have a Yahoo account. Okay. PLCOATES 2003@yahoo.com, and I will answer. And just, some advice, I just encourage everyone who wants to try. And even if you don't get it the first time, keep trying and trying. I have met people that have tried for years or had been practicing for years and decided, you know what, I really want to try this. And they walked away from practices just to follow their dreams. So, and if by chance it doesn't happen, if you're a general dentist and you have the heart to treat children, majority of the children out here in this country, they're treated by general dentists. So you can treat these kids. Just know when to refer, stay in your lane. If you want to learn more, attend, the academy meetings, because you'll get the best CE about pediatric dentistry there. We have membership on the level for general dentists, same benefits that I get as a pediatric dentist. So if by chance you're not able to get into a residency, you still can treat children and still be a blessing to them.
Right. And contribute in the overall profession and treating the kids as well.
Absolutely. So, I say stay encouraged and try. Keep trying.
Awesome. Hey, thank you so much, Dr. Coates, Dr. Paula, for those words of wisdom and things that you would do differently, and just an overview about how to become a pediatric dentist. If you guys have any further questions or have other topics that you too want to hear, be sure to shoot me an email right there, newdentistcoach@gmail.com, newdentistcoach@gmail.com, okay? And then also be sure to check out the next video that's coming right there. There it is. Check out the next video right there. Dr. Coates, thanks so much. We'll talk to you soon. All right, bye.